I just knew that I needed to get him to medical care as quickly as possible.
I just remember looking up and it was a clear night and I could see the stars, and I remember asking God, am I going to die?
Dakota wouldn't be here. He wouldn't have made it.
Because in that moment, your life just changes. You know, one minute I'm married and the next minute I'm a widow.
The Circle of Life is indicative of the services that we provide at our facility. Whether it's a parent's proudest moment when they're delivering their first child, or a family having to say goodbye to a loved one, we are there no matter what stage of life a family is experiencing.
I think living in a small town offers a good healthcare connection because you know your healthcare provider on a first-name basis. You can access them almost at will. It has the amenities that a big city offers as far as access to care, really.
I was 16 years old. My friends and I made the bad choice of buying alcohol. We got very, very drunk. And I got in with a man, and we were driving towards Lewiston. And it was November 6th. We hit black ice going about 85, and we flipped on the passenger side, and we both got thrown from the vehicle. He came to, and he tried to find me, and he couldn't find me. And so he stopped a truck driver, and they looked around out in the field for about an hour, and they found me and brought me to St. Mary's Hospital. I remember them prodding me and was trying to find out what was wrong with me. My vitals were extremely low because they knew that I had internal bleeding, and I had hypothermia because it was so cold. And then also my right ankle was blown apart, and so I lost a tremendous amount of blood. I know that St. Mary's is a small hospital, but for people like me who had an accident and got brought in to that small hospital, they still had the knowledge and the skill to do what they did. I could have died right there if they wouldn't have had the knowledge to sustain me, to sustain my vitals, to put the blood transfusions in me, and to call MedStar and say, get down here right now. My husband and I love to bow shoot, go to archery shoots. We love to hunt elk, deer, fish, and go camping. It's the best feeling on earth to be called mom. I love my kids more than anything. It's a love that isn't like anything else. It's changed my life in that I'm thankful for every day, because I know that this life can be taken from you just like that. I do believe that if I hadn't have been brought to St. Mary's, then I would have died. I know that the doctor said 5, 10, 15 minutes and she would have been dead. God has blessed me with a handsome, wonderful man and 2 beautiful children. I'm very blessed.
Dakota was just great at birth. He had a great healthy birth and was doing fine, but at about 6 weeks old, he developed a slight cold. He was still eating pretty well, but I could tell that he was just going downhill. I decided that we needed to go see the doctor at the hospital, so I called the hospital to alert them that I was coming, and my oldest son was holding Dakota. All of a sudden he said, "Mom, he's not breathing." So I rushed him to the hospital with my 2 fingers on his little chest going, "Breathe, Dakota, breathe, Dakota." We arrived and the ER room was ready for us, and they worked on him for quite a little while, gave him fluid, and were able to resuscitate him.
And I got to the hospital and found out what had taken place, and that they had stents in his legs, giving him fluid, and an airbag on him to breathe, and it was a nightmare for a while.
As everybody was rushing around in that emergency room, the one nurse took over breathing for Dakota with the bag, and she did that for 2 hours. She was asked if she needed to be relieved, but she said, no, I will keep doing this.
When Dakota Wilson came in to the emergency room, he was very ill, and just knowing what I saw that night, I do not believe that he would have made it if this hospital was not here.
First thoughts was he wasn't going to make it. Seeing the doctors, the tubes, and everybody's face. We have real good doctors here, and they were doing everything they could. And they brought him back.
Every birth of a child is a miracle, but Dakota is our miracle twice.
I think I'm the miracle baby because all of us, all of the people at the hospital had to work really hard to keep me alive while I was trying to breathe, but I couldn't.
We found a print that we liked real well and had it framed and mounted and donated it to the hospital and for giving Dakota back to us.
Now that I see this child in the community, it makes me feel well and makes me feel warm inside, knowing that this infant has turned into a young man, and this hospital, and I was here to help him be that.
Our hospital here, well, I'll put up against any hospital in the nation. The staff we have and the way they've treated our family through that incident and broken bones later on, you can't place them any better than they are.
I met Glenn through my sister. She was opening a convenience store in Elk City, and he walked in, and so we just started talking, and that's pretty much how we met. Glenn played an important part in my life to connect me with photography. He was very much into the outdoors. We were at a marriage encounter. We had to do a lot of walking. In this walking thing, his side began to hurt. And the following week, we were to go to Seattle. And they did a CT on him. When we got back to town, they called and said that it had jellified, this rib had, and that he needed to have a biopsy on it. And it came back that the cancer, he ended up with liver cancer, and it had metastasized and spread into his bones. He made the decision to not do anything. Semi became a very important part in Glenn's process of his dying, and they became very good friends. They'd walk down to the post office every day and get the mail, and he had an adopted daughter in Newcastle, Wyoming, and he wanted to go see her. On the way back, Glenn ended up in the hospital over there bleeding. I called Sean, my home health nurse at Cottonwood, and said, this is what's going on.
We just had everything ready so that when she got into Cottonwood, it didn't matter what time it was, I will be here.
A really important conversation I remember having with her was about acceptance, that it's easier for the patient to accept the death than it is for the family member to accept the death.
I think people should be able to have a choice to die at home or to die in a hospital. And I was very pleased that we could provide a service to Glenn and a support to that family.
As Glenn got closer to the end, I don't believe that I could have done what I did without home health.
To spend time with Debbie and Glenn and to help out in that way just seemed a natural part of my job, that I could switch gears and I could sit with him as an acquaintance or a friend. Of course, I was always the nurse, but for Debbie, I was the friend.
The only people present here was my friend and the pastor and his wife when Glenn passed, and Semi. And the peace that was over him was remarkable. It was just, yeah, I would do it again. I would do it all over again to give him what he wanted.
being that close and having the hospital here that close. He's with us today.
I wouldn't have made it. 5, 10, 15 minutes and I wouldn't have made it if I wouldn't have gotten the blood transfusions and the assisted medical intervention that I needed.
And he just helped me get through all the stuff that I did.
She just helped me. Just supported it and helped me work through my grief. And the acceptance of his death. There was just, it was just amazing to see how one person could do so much right there.